Yalla, Bismillah. Assalamu alaikum. My name is Muhammad Sadiqli. I'm orthodontist, and as maybe most of you know that my best hobby is the photography. So lately I make that photography and dentistry course, and actually this lecture or this webinar is a part of this course. Today I choose to talk about the most important element in the photography triangle, or the exposure triangle, is the aperture. Aperture actually something that in your camera that you can control manually to have like several mode in your photos. All right, now we are starting. All right, learn how to control aperture. Everything is fine. If there is any problem in this webinar, there is a chat box here in the webinar. You can just write anything you want. For this webinar, actually the question and answer will be at the end of the lecture. So anything you want to ask, just write it in the chat box, and I will read all of your questions and try to answer them all. If there is bigger another topic that you want to ask about and need more time, I will answer it through the email or through the story in my Instagram. All right, I'm seeing if there is any problem. I don't know that someone told me that they can't all entire. All right, they can't type. I see you can actually use. Okay, now it's okay. All right, there's a box that you can write chatting. All right, and now they started to. Okay, very good, very nice. All right, let's go. Yeah, aperture. Before I talk about the aperture, I will explain a little bit about the exposure. Okay, exposure in photography. As all of you know that everything in photography is based on light, all right? So the photo is about the light. Everything you see in the photo is light reflection on the object that you are taking photo for, all right? So the exposure is the amount of light per unit area reaching a photographic film, all right, or electric image sensor. So it's the amount of the light. The exposure is the amount of the light in your photo. Uh, I don't know if some of you familiar with this photogrammetry terms, like if you heard about that low exposure photo or high exposure photo. This is the exposure, how much light in your photo. And if you know how to control this amount of light in your photo, you are a professional photographer. All right. The exposure actually determined by three elements, three main elements is the ISO and the shutter speed and the aperture that we'll talk about today. The ISO is the sensitivity of your sensor if your film actually. And the shutter speed, the speed of the shutter releaser. All of these terms actually I will talk about in my photography course, and I will explain a little bit about it in this course. You can see it here. This is the exposure triangle. All right, this is the ISO, how much your sensor is sensitive to the light. If your sensor, if you set your sensor like on 6400, it will be high sensitive for the light. So you can use the camera in a darker situation. And if you put it on the 100, that the sensor will be like low sensitive to the light, which will be your environment or your object must be already exposed by another source of light. All right. The shutter speed is the how much the shutter is speed when you take the photo. It's a high speed or low speed. Actually, to understand more, if you have like high speed of your shutter, all right, the shutter will open a little bit and close directly, so it will not let a lot of light to enter inside your camera. So if you have good exposure object, you need high shutter speed. But if you have like darker object, you need low shutter speed. For aperture, it's easy actually to understand. It's how much your lens is open. See the aperture here. So we have three triangle, three element, which means it's a triangle, and we call this actually triangle is exposure triangle because they are related to each other. When you increase the ISO, you can decrease the aperture, you can in the same time to increase the shutter speed, and the result will be your photo to be proper exposure. All right. As I told you, all of this information is from my photography course, photography in dentistry. This course is online course from like around 55 recorded video. You can access all of this video when you buy this course from iDental Academy, all right, website. And all of you now here, all of you here, wait me until the end of this lecture. There is a surprise for you, okay? So let's go through to this lecture, and at the end of this lecture, I will tell you what I'm going to give you. Aperture is the one of three pillars of photography, and certainly, as I told you, the most important because it controls many things in your photo, in your result. And as I told you, is the opening a lens through which light passes to enter the camera. How much your lens is open or closed. You can control this one. Your lens is big or small, all right? And you can see it here, this big aperture, which means small f number. We measure the aperture with f number, all right? Big aperture mean small f number, and small aperture mean big f number. So here f22 and here f2.8. For you to know more about this, I will open my camera, all right, and I will show you directly. I don't know if this one is clear to you. Let me see here. Where is the camera? Here, all right. Okay, you can see it here. The aperture actually is this one, f. Okay, this is what I mean. You can make it 2.8. I will show you like this. See, now it is 2.8. This is the aperture. Okay, and you can make it in same time until actually it depends the lens. Here it's 32. I don't know if it's clear for you or not. Okay, so this place you can control the aperture. Let's go back to our lecture. So here, big aperture, small number. Save it like this. Big aperture, small f number. Small aperture, big f number. All right. So as I told you, aperture can be expressed as a number known as f number or f stop, with the letter f appearing before the number like f on 8. Okay. Sometimes we put this on, or sometimes you can see you can maybe in another brand, you can see that only F8. Okay, it's not necessary to see this hash here. To understand more the aperture, let's think about it as our eyes. Aperture has same function of the human eyes. So the aperture for the camera as our eyes exactly for ourselves, and especially the special part is the iris. So when we have when we are outside or we are looking for something exposed by the sunlight, we need there's a lot of light. So our iris will shrink to make the pupil smaller, which will make the amount of light less to enter to our eyes so we can see the object or the subject that we are looking at clearly, because the light is too much. So we need to close the pupil a little bit so we can see the object in a good exposure, in a proper exposure. And in same time, in the opposite way, if we are in a darker situation, we need more light to enter to our eyes. We need more light to enter to our eyes, which means that the iris will expand to make the pupil bigger, so the light will enter more to our eyes so we can see the object or that the view we are looking at in a proper exposure. The goal is a proper exposure. That's what we do exact in our camera here. If we have high exposure object, we use big number of f-stop, which means small aperture. And if we have darker situation, we make it smaller in this way. All right, let's go to the next slide. Now, aperture, as we explained before, for sure, it controls the light, and at the same time, it controls another thing also, the depth of field. That's why the aperture is really important. This what will make the difference in our photos when we understand the depth of field and how to control our camera to give us the proper depth of field or the depth of field that we need in our photo. All right, let's see together. For sure, the light here, I make photo for the same object. For the same object, here I make it f29, which means is the aperture is small. Okay, see the light is proper light. Maybe if I make it like 25, it will be much better light for this photo. And here when I make it bigger, I make it f13, the light will be more. So this photo is higher exposure than this one. This one is high exposure photo. This one is, we can say that proper exposure photo. If this photo is darker, we will say about it the low exposure photo. And what happened here? I only changed the aperture. Aperture here is bigger, which means smaller number, and aperture here is smaller, which means bigger number. Okay, actually, I think it's clear and easy to understand. If there is any question about that, please just write it and I will answer everything at the end of this lecture. The next thing that another thing or the most important, in my opinion, the most important element in your photos and the element that show that you are really understand the photography very well is the depth of field. Especially in intraoral photos, it will appear very well in your photos. It's the amount of your photograph or image or photo that appears sharp from front to the back, from front to back. Okay, sometimes you can say that you can see that part of your photo not sharp, or maybe another part is blur, but here I'm talking about the front to back. All right, front to back, the depth of your photo. Here you can understand more about the depth of field. Here I made the aperture smaller, which mean here what? Let's remember together, smaller, which mean is big number. Okay, big number. When I made the aperture smaller or small aperture like 22 or more, I have here deep depth of field. So I can take also the background of the object in same times in focus. Here I can see the background, which means I made the aperture smaller, which means I have deep depth of field. Okay, so I can see here and I can say that the background is kind of in focus. But here I made the aperture bigger, which means I used a small number of aperture, a small f, like less than 12, less than 10. Sometimes we can use 5 or 2.8, and some of lenses has 1.8 actually. Here you can see the background is out of focus, or maybe you can't see it at all. Here, another term we can call this object is isolated. All right. So here we have shallow or thin depth of field. Okay. Here, shallow or thin or big aperture, small f, which mean background out of focus. This one. And here, large or deep depth of field, which means small aperture or big F here. It's write a mistake. Big F, which mean is foreground and background are sharps. All right, and for sure there is more example to understand what is the depth of field. Here I used big aperture, which means small number. Here you can see that the depth of this photo, the depth that I could focus on it is so much shallow. And you can see in same time that the background is out of focus, and also the hand here and the iPad is out of focus, because the area that I can focus in is shallow or thin depth of field. Okay, because I used a big aperture or small number of aperture. This normal photo with isolated subject. Here we can see the dental example. Actually, the small aperture in the dental photography, I use it for the close-up photo to make artistic photos. This without any editing, okay? As it as I take it exactly, without having editing to make this blur. Here I used these settings, okay, with large aperture. Here the f was 5 only, so very large aperture. So as you can see here, I focused only in this area, only the area of this bracket. So I want to show to my follower this bracket only. When I make it isolated, the background is blur and also the foreground is blur. Only the object that I want to take photo to focus on is in focus. So here the depth of field is shallow because I used big aperture. Okay, and we can see another example here also. The background is blur, the foreground is blur. Only the object here I used, I made focus on. Okay, to understand more, there is another thing that you can save, okay, in your mind, so you will understand what is the shallow or uh, deep. Here, if the shallow or thin depth of field, which mean is large aperture, which mean is results in large amount of blur. This photo has a large amount of blur objects. See this blur and this blur. The background all blur. This one is blur. Only this object, this bracket is in focus. Here for sure you need to use manual focus in your camera to take a photo like this. If you use autofocus in this situation, the camera will be confused and sometimes will focus here or here, and you can't take the photo that you want. So I prefer to use manual focus in this photo. So here, shallow or thin depth of field, which means large aperture, result in large amount of blur. Okay, and here the opposite. I used small aperture, which means big number. So small aperture result in small amount of background blur. See, there is nothing here blur. Everything in focus because I have deep depth of field. Okay, everything, all the photo is the foreground, the object, the background, everything is in focus because I used small aperture, which gives me deep depth of field or large depth of field. Okay, here all the deep of the photo is in focus. Everything is in focus because I used a small aperture, and this one we can use it, and actually we use it in our practice with the full arch photos, especially in orthodontist. We use small aperture, usually bigger than 22, because sometimes you can't find a lens that have bigger than 22. So 22 or bigger, I mean the number, so 22 or bigger, 22 to 32. So all the arch, the front teeth, and the back teeth will be in focus. Okay? Small aperture result in a small amount of background blur. So if you want to take full arch photo, okay, full arch, the front teeth and the back teeth, everything, the anterior teeth, the posterior teeth will be in focus with the arch without having any blur in your photo. Anything out of focus, you need to use or you have to use small aperture, which mean big number. Let's see that also in next slide. Here, I shared with you the settings that I use to make this photo, this intraoral photos, this intraoral photo with Studio Flash. You will see that when you take the photography course, how Studio Flash have this kind of problem because of the big soft boxes. The light will not enter to the end of the arch, but you can notice here this teeth actually in focus because I used big aperture. In this photo, I used 29 actually, exactly. You can take this result if you use 28 to 38 aperture. So all your teeth is in focus, the anterior teeth and the posterior teeth. If you see that your anterior teeth is in focus and the posterior teeth are blurred, this is not good intraoral photo actually. And you can see that also in the next slide. Here I use the twin flash. The twin flash will give you a proper lightening in the posterior teeth. You can see here very clearly the posterior teeth are in focus, clearly in focus. They are so clear. Everything is in focus as the anterior teeth here because I have deep depth of field. Okay, deep depth of field. So everything in focus. The anterior and the posterior teeth are in focus, and that's what we need when we make this kind of photos. So don't use big aperture or small number. So don't use like 10 f10 aperture with this kind of photo. Use big number, 22 or more, to have this result. All right. For the aperture, I always tell my student that you are free to choose anything, but as you know, there is limits. But for close-up photos, you can use anything you want whenever you are aware about your source of light and you can really control the amount of light that you have. Because as you know, if you use big aperture, like small number of aperture like f10, you will have big aperture, which means that if you have like heavy light or like your light is in an or in high energy, you will have high exposure photo. So you need to control the light. If you have big aperture or if you want to take photo with big aperture, you need less light, less energy of your flash. So you want to reduce the flash to take less light so you will have proper exposure for your photo. Here, I choose to have this kind of photo, close-up photo, with small aperture, which means with big number of aperture. Okay, I'm just checking the voice, everything is okay. Anything, just please send me question or send me any notes, I will answer them all again. Everything is understood now? Please, if you are with me, just write yes and big yes. Yes, okay, with a smile. Okay, everyone. Yes, let's continue. Here I shared with you the this intraoral photo. This one I used ring flash. Always I put the ISO on 100. Always. Maybe sometimes 1%. Just I use more than 100. I don't like to use more than 100 because you know ISO will affect the quality of the photo if you rise it. And shutter speed usually also the 100, 1 on 160 until 1 on 200 is the most common shutter speed. Not less than that and not more than that. And why not less, what not more? There is actually a lot of things that you need to know. You can find it in my course. But usually these settings I use ISO 100 and shutter speed 100 on 60 until 200 1 on 160. And here I use aperture 22. You can see everything in this photo is in focus. The soft tissue, the you know, here I used aperture 22 because I need to have everything in focus. If I use less than that, like 10 aperture, only 10 f10, maybe the open coil will not be that clear, will be out of focus. Maybe the camera will focus on this level and will not focus on the inside element, like this soft tissue or that the open coil, or maybe it will focus on open coil and this cusp will be out of focus because you know that foreground and background will be out of focus. Only the area that in focus will be clear. All right. So here I used aperture 22. Everything is clear. Here I use the aperture smaller number, which means bigger aperture. Same settings, ISO 100, shutter speed 100 on 160 enter 200, but the aperture here was f12. If I have same source of light here, I need what to do to reduce the light because I used bigger aperture. The aperture is bigger. The light will enter, the amount of light is more than the previous photo. But here you can see the tongue of the patient is out of focus. Why? Because I need the follower to notice this area. If the tongue also in focus, this photo will be lost. Here I need the patient just to focus on the open coil. So everything else is isolated. Everything else is out of focus. Okay, so when I focus my camera on something, the follower will focus on it. So I made my follower to focus on something in the photo. See how much is beneficial the aperture understanding. Okay, and for sure, as I told you, when you have close-up photo or big aperture, use the manual focus. As we know, all of us, the lens has this switch, autofocus and manual focus. All right, you can use the manual focus in close-up photo. And this one also, you can see here, I use aperture 12. See here, the lip of the patient and the retractor, okay? Be careful. The retractor, I used retractor to retract the lip, the C retractor, okay? To take the lip away from the view. Here, if I use big aperture, the retractor will be appear and the reflection on the retractor of the light will be appear. But because I isolate this view, only these two teeth, using big aperture, which means small number of aperture, I have this result. Actually, it's in my Instagram. It's like with 500 likes just because of isolation. It's simple. Here I used Studio Flash, and you can see the isolation here. The background is blurred because I used small number, which means big aperture in this photo. Okay, and always remember to to control the light, reduce your flash, reduce the energy when you have big aperture, increase the energy if you have small aperture, so you need more light, you need more exposing for your object. Everything is understood until now? Any question? All right, let's continue. Now, as I told you, when I finish this lecture, there is something for you for my photography course. The photography course, actually, I want really to take you a little bit for this course to show you what is included. Actually, you can just go to www.identitalacademy.com, okay, to courses. Let's see together. This is the courses that we have, okay. You can see this is the courses that we have, and this is the photography in dentistry course. Let's go through to see what it has. Actually, in this course, I talk about everything in photography in general, and also in same time about the clinical or dental photography. Let me just take something. All right. First, I started about some ideas about the photography in general, why photography, when it started, and then I talked about the camera types, and then I talked about the lenses and exposure, everything about exposure. This is the aperture, all right, and about everything about the lightening. And this course actually is frequently update. So last time I put these 3 videos before 2 days, some tutorials about the soft boxes and umbrella and another thing also. And for sure there is some training that I hold my camera and take photos and I show you live results to understand exactly what you need to do in your camera. And for sure everything about mirror, retractors, contrasters, the setup for your chair on chair studio, or if you have separate room to set up your room, everything in photos in dentistry, the face photos, smile photos, intraoral, some mistakes that you don't do it, and specific intraoral photos, and for sure shade selection. What about the raw files? And at the end of the course, I talk about the Photoshop, little bit about the Photoshop, how to use Photoshop to edit your photo, okay? And this everything about that course. For this course, actually, the original price for this course is $300. The current offer for these days when we launch the course is 100. But for you, the attendees only, okay, I made a special promotion for you. A special code is 30 smile, that to start smiling from now and start your photography journey, because really it will make different in your practice, make different in your Instagram account, it will make different in everything. Really, the photography, when I entered the professional photography to my practice, it was really life-changing thing that to use in my practice. So for short time only, this code will be available for 24 hours. You just enter to, I will type the website, okay, identitalacademy.com, or maybe I can share with you the direct link, all right, for the course. I will make copy here and paste for you. You can enter now to see the course. There is some videos actually are open to see the previews about the course, about the element that I have. If you have any question, you can send me email or DM on Instagram. I will answer them all. If you have anything that you need, just ask me, please. And the discount will be 30% just for you, okay, just for you. The code actually is working for 24 hours only. It's 30 smile, okay. I will type it also, 30 smile, you will know everything about the photography in dentistry. Enter this link that I send on the box, and when you want to pay, just type 30 smile in the code place, so you will have 30% discount and the price will be $70 only. I hope that you enjoyed this lecture with me, and for sure there is upcoming events for photography and for everything in photography and for another topics actually. As all of you know that I have also the Instagram for doctors course. You can see it only also in our academy, www.identalacademy.com. Okay, identalacademy.com. This is the sorry, this is the link for the Idental Academy. You can see all of our courses in the academy. And for sure, if you want to know more about the photography, or if you want to see that if this course is good for you or not, you can book 15 minutes with me as a virtual coaching on Zoom. You can have one-to-one one-to-one meeting with you, me and you only together, live video. Just if you have any question, or if you want to know more about the photography in the dentistry, so you want to know that if this course is good for you or not, you can book with me free consultation with virtual coaching link. You can find it also in iDental Academy. Okay, just enter the website and choose the virtual coaching and book 15 minutes with me through the website. You can, sorry. Sorry, I'm a little bit sick today, but so you can book with me 15 minutes as the virtual coaching to know if this course is good for you, to know what you will and learn in this course, or whatever you need. I can help you actually. Or if you already bought this course and you need also live training, you can also book 1 hour through the identalacademy.com coaching, live coaching, or live coaching, like direct coaching for your camera or for any topic you want. I was really so happy with you in this lecture, and I hope to see you all again. And thank you so much to attend this webinar, to accept my invitation and attend this lecture. Thank you again, and see you soon. Muhammad Sadiqli was with you, and thank you so much, and goodbye. Assalamu alaikum wa Ramadan Kareem.